Hello everybody, my name is Mikhail Telichko. In this video I'm gonna provide a visual explanation to 4 methods that I mentioned in my open letter that I sent to multiple facilities, including government facilities, institutes, universities, hospitals, and some individuals that I want to emphasize 4 methods that are extremely effective to fight not only this pandemic but overall improve our nationwide infectious disease safety, which is a crucial thing. Just 2 words, why am I doing this video? So because before I moved to the United States 3 years ago, I used to work as a mobile ICU physician in special setting which was called disaster medical response service that was focused on things like mass casualty incidents. And in the back of my head I always had this idea about what happens if we have something globally going around, some mass issues. And now we have it, and I'm actually really surprised by how medical society and community reacts to it, and taking into account that United States is really advanced country. It's surprising for me to see some struggles and efforts that have been done, some restrictions that we have put in place, some things that we applied to try to fight this pandemic. At the same time, we ignored some really simple, effective things that they have been used for decades. The things I'm going to be talking about, it's nothing extraordinary, nothing super new. It has been in literature, it has been used for decades, some of these methods. Just what I did, I summed it all, and I've been looking for things that we can easily implement. So the greater paradigm, the biggest point I'm going to pivot on is that the COVID actually is not just a separate disease. It's in a much greater scale, it's a symptom of our general worldwide vulnerability to infectious disease. There's many causes that make us vulnerable, but we can see epidemics arising, and so we just have some situations in place that help us to spread those diseases and allow them to thrive and mutate and become more aggressive, more virulent. So, and it's might be really hard to identify all of these factors, such as like increase of elderly population or increase of chronically ill people because they can now live longer because they have medication that can save their lives, but they live with immune suppressed stages and things like that. You can talk a lot about it, but eventually you might not be able to identify all of the things, and you might not be able to control them. And contrarily, it's fairly easily to identify the weak spots we have in our safety and security, and actually group those parts in the ones that are easily achievable. That's what I've been doing. That's the research I've been doing. And when I've seen people implement different things like wearing masks, quarantines, and many other policies and small procedures that I've seen, many of them have seemed a little bit weird to me, and I refrain from criticizing them openly and right away, because maybe I'm just missing something. Maybe some things were so crazy that I basically couldn't believe that there's that it can be so crazy and people just do it. So I just thought maybe there's something I don't understand, maybe there's something I miss, and maybe it's something I missed in my training. But as the time grew, I did my research, and unfortunately I figured out that many of the things that have been put into place, into action, they're actually just not smart things to do, but there's much easier, much better things to do, which I'm gonna talk about right now. And so that's what I did. I identified the things that are both really effective and can help improve our safety dramatically. At the same time, they're really easy to implement, and they don't alter our daily activities a lot. So compare, quarantine might be easy thing to apply and it might be effective thing, but it alters our daily activity, it alters economical situations so badly that we understand it cannot be a lasting solution. It cannot be something definitive that we can just change in our society and we're gonna stay, safer because the situation may. And we have many instances when we had to adapt, such as, for example, when we understand that car provide emissions, we put some laws in place that restrict that, we improve the cars exhaust systems to make emissions less harmful, or when we face things like in hospital infections, like multi-drug resistant infections, we came to fairly simple conclusions that we have to improve something in our hygiene, improve the level of sanitization of, do the things that can help prevent that, and that just came into the medical routine and it stayed there. So the same thing we have to do right now with our daily activities. There's some things that we have to change. What I identified the easiest and most effective things that we can change, and I want to share those things. So those are as follows: vertical laminar flow ventilation, which is basically changing ventilation system indoors, and we can do targeted quarantine and targeted testing by tracking people with anonymously track infectious contacts and inform people of being in contact with the infectious. So we can do targeted sanitization of surfaces, online sanitization, and we can improve our PPE dramatically. And many things I came up, they have been in paper. This is just a small example. So this is the way that CDC did this in paper before the pandemic. This is just this pyramid shows the things, how different approaches influence fighting environmental hazard at the workplace. But if we can put it to the bigger scale, let's say to the workplace of healthcare providers, or to the our general daily activities, and this COVID being as a hazard in our general daily activities as a workplace, a work environment. So we can see that things like PPE and administrative controls, such as don't go there, don't do this, they have less effect and they may be really hard to put in. But things like engineering solutions, substitution, elimination, those are things that are much more effective, and those are the things that's why I concentrated on hold this topic whatsoever. So let's start with the airflow change and ventilation system. So this is a picture of vertical airflow laminar ventilation system. It has been used for decades in so-called clean rooms, where there's virtually no particles available because you have to do some high precision machining, such as making and manufacturing microprocessors and things like that. So that has been worked and used, and this is the most effective way, but it has been thought that it's a really sophisticated system, but actually is not, and we can virtually change any place to work like this. This is the same way they use it in some operation rooms to achieve reduction of infectious rate of big infectious wound by applying the same principle. So I'm gonna talk how it differs from conventional ventilation that we have in place, and usage of standalone air purifiers that I've seen in many hospitals, and how those are ineffective, and what simple changes we have to do to make them effective. So this is a general principle, and I encourage everybody to go around your workplaces, around supermarkets, the places you go, and just look at the ventilation system setup. So you can see grids on the ceiling. Some of them they put air in, some of them suck air out. But this is the way how the air goes, and as you can see by those arrows, the air inside goes turbulently. It actually mixes heavily inside. And if you want to trace the general air movement trajectory, so you can see that they're being supplied from one place, and if there's an infectious person close to there, or there's just air is already contaminated, so it's going to move that contaminated air towards other people, effectively infecting them. So this system, it actually moves air from one person to another. It keeps the particles suspended because of the turbulent flow, so it actually interferes with the natural way of particles just going down by the use of gravitation. And the same thing is done by the air purifiers. Even if they emit straightforward sterile air, it still gets contaminated instantly. And there's a big confusion in using a term which is air exchanges, which has been used as a pretty versatile tool in engineering of air ventilation. And it's great. It applies to things like CO2 or dust in the air, because if you change air frequently enough, you can eliminate those things. But it's okay if you just need a reduction of those things. If you just reduce the level of CO2 to the normal level, or if you reduce the dust to some level, that's still beneficial. But if you just reduce the amount, and it takes a lot of time to reduce the amount of those airborne infectious particles, it's not enough, because you don't need a lot of them to get infected. So you can still get infected by even having huge air exchanges in the room, or applying extremely expensive huge air purifiers into the room. You can still get infected. And partially the physics behind it is called air entrainment. You can see it like here and here. So this is a commercial from so-called bladeless fan, and this is just to show, so they did a picture to show how effective their system is, but it actually shows what any introduction of high velocity flow, which we have here, this is a high velocity flow being introduced into low or zero flow environment. So what it happens, because of this fan, it blows a tiny, like a slim high velocity flow. That flow traps air that is around it, instantly mixes it. As you can see, it can entrap as much as 15 times more air than being introduced. So if you have any single emitter pushing air in the room, it's gonna mix instantly with the contaminated air in the room. Thus, at max, what it does, it just slightly reduces the amount, but it actually still keeps 15 times more infected air is being mixed to that thing. And so it actually can provide it can actually questionable, whereas it can actually help, or maybe it just facilitates infection instead of helping. So again, this is how the system works. It gets people infected. This is the simple solution to it. This is the simple conversion of that exact same system to a vertical laminar flow ventilation. And for this purpose, we need as much as just a hose and some semi-conductant material, porous material, or just even a perforated plexiglass will do. So what it does, instead of just pushing that air straight in, we dissipate that high velocity flow by introducing this membrane here. This layer here is like a second ceiling, and you can imagine if that's just a plexiglass that has multiple perforations in it, so each hole does not allow a high velocity flow go through it. It just emits a little bit. But when the high velocity flow is introduced from one side, it's being distributed on top of that whole sheet, actually making a nice, smooth, even flow going from top to bottom. And so what we get by this, so each individual in the room gets a independent amount of fresh, separated air without mixing. It also actively pushes all the particles down immediately. So even if it doesn't eliminate it right away, it gives you fresh air instead of mixing with contaminated air, and it pushes the particles. Instead of keeping them suspended, it actively pushes them towards this suction grid. So we drop the hose from the return side, and now the air is being picked up at the bottom, and it's being filtered, or you can use UV radiation to cut expenses on extremely expensive HEPA filters to achieve the same result. So this is as simple as it gets. And if this and I wanted to trial this system, but the way I'm doing this video, because I had zero response, I've tried to contact multiple people, and nobody even helped me to conduct this simple trial to build this. I can easily make this in any room, and we can easily convert any place you go, any school, any supermarket, any hospital, to operate with this way. And it's extremely cheap because it uses extremely cheap material without any significant alterations in the ventilation system. At the same time, if this system would not be powerful enough to actively fight against the turbulence that we create by just walking around, moving, breathing, we can just supplement it with adding an air purifier here. Just the only thing we have to do, we have to direct the hose from that air purifier, so it's going to be facing the ceiling and going above this this sheet that we have, this semi-conductant, or how would you say, semi-porous membrane or whatever. So it just distributes. The only thing it does, it diffuses, it distributes the air, and then it gets collected in one place, and it gets pushed down away from your respiratory system intake. So just this is how it looks, the other like 3D model. And I'm sorry for the picture quality that I have, because I have to do all this in my free time, and I don't have much of that, and I have zero support. This is my solo project. Nobody helps me with that. Just one thing that I had help is an app, and I'm gonna be talking about it, and I'm really grateful for that help. But this is what I have. So again, we just need simple materials to achieve it, as simple as foam would do to make that extra sealing. But again, using plexiglass can allow you to still get light from the ceiling and things like that. And you can actually some things like that you can see ceiling using some of those materials used in the ceiling. So this is not something incredibly rare or impossible. And this is, again, just to recap how it works. The conventional systems, they mix air between people, they keep particles suspended, and they don't eliminate them, but they constantly mix fresh air with contaminated, versus the laminar flow vertical ventilation system actually actively pushes down all the particles towards the outlet, and it supplies everybody with clean, independent air supply. Okay, so how about surface sanitization? It might be a hard topic or hard thing to achieve, and we see many chemicals being used, UV radiation being used, and many of those things are extremely inconvenient. For example, you cannot have somebody 24/7 just standing there with the wipe and wiping elevator knob after each touch of each person. It's just virtually impossible or extremely expensive, not to take into account the things like chemical exposure or UV radiation exposure. If you have just randomly placed UV lamp or some of those chemicals in UV light might have like a corrosive effect, which is not beneficial. And of course, when this UV lamp operates, nobody can be in the room, or you have to put such a weak lamp that it doesn't do anything. So this is a principle how it's being used and how I've seen that used. If you want to use UV lamp, so people just put it somewhere on top, and as you can see, the light from the lamp gets easily dissipated. So we have two faults in this system. First of all, the biological hazard. The person here gets irradiated for no reason. It doesn't need to be irradiated. And the other issue is that amount is so small. The amount that reaches our target surface is so small that it's actually ineffective. That's because of the reverse square root or law or any other law, but just generally the physics behind it is that it's getting dissipated. So the further you go from the light source, the less effective it is, and by just a few inches or even a few feet or even inches from that UV lamp, the effectiveness of that dissipated light drops down immediately and dramatically. So there's super easy fix to that. We just apply a few reflectors, and regular aluminum foil or any other metal reflector would do. Same thing as we do with flashlights or headlights of the car. So we collect that UV light. Instead of being dissipated, it gets focused on the area of interest here. So all 100%, or maybe not 190 or so percent of that UV light gets here, and it can stay like that 24/7. So it keeps sanitizing. Anybody who touches it, the second the person removes that his arm from the knobs, those knobs are being sanitized right away. So the system keeps it sanitized at all times. It is extremely effective way to stop the spread through high touch surfaces. And at the same time, we don't have any hazard. None of this light is being emitted and falls on that person. So this is extremely safe. And UV lamps are cheap and durable. The only thing you have to do, you just have to put them, and you can put as much of those as you need. You can use actually some specific light wires that they can move the light, and you can target it whenever you need. That's the whole other topic, but just this is how easy it is. So before we jump into the PPE, I want to talk quickly about targeted quarantine and targeted testing. So this is the app that my friend David Chappell helped me to build. So he actually built it, and I just provided the idea, and I'm extremely grateful for that. But this app is a prototype that shows how easy it is to regain control of our situation. So instead of just blindly quarantining everybody and just guessing who might be infected, we can actually trace it, and we can do it. What's the most important, it's completely private, because this app does not collect any of your name, address, telephone number, nothing about you. The only thing it does, what it does, so it collects the day. So it collects the day when your number that is being randomly assigned to you, or it can be a QR code here, or you can modify it to work via Bluetooth, doesn't matter. So the only thing you get a number, and if you scan the other person number, or if you have a Bluetooth connectivity and that person has the same app on their phone and it connects with your phone, meaning you have been close to each other for some time, it automatically just marks that you have been close to each other that day, but it doesn't even know who you are. It keeps that whole data encrypted, anonymous, and it deletes it after 30 days because you don't need it anymore. So, and what it gives us, in case that anybody gets sick, you can send the anonymous alert. You see, you can send it. So I don't type in any message, just sends the standardized message to anybody who I've been in contact. I don't know who those people have been. They don't know me. I just send them standardized message that I have been diagnosed with some infectious disease, or I have some symptoms of infectious disease. So they should stay quarantined and follow up with their doctor, maybe do some testing. So instead, that app, just this is absolutely free. This is absolutely simple, and it renders the whole lockdown unnecessary, because we don't need to lock down. We just need to quarantine. We can implement it from day one of epidemic, and we can implement it still. We can do it with any other pathogen, any other disease that we can mutate and break out and cause the same situation as we have with COVID right now. So, and people say that, well, it's not going to be popular because people will still be afraid for their privacy. Well, then this is like it might conflict with some of our freedoms. Well, this is not true, because people have been forced to wear masks, which is a huge thing, a terrible thing. Not that it's bad, just it's so uncomfortable. There's so many issues with it, and people have been hesitant for it. But they still did it because, and we still do it. Everybody does that because there's a sign on supermarket saying, "No mask, no service." We can put the same sign saying no app, no service, and just let people come indoors with those apps on. And of course, it relies on personal responsibility, personal accountability to inform other people if you got infected. But so does the mask rely on personal responsibility to keep them clean, to change them frequently, and nobody actually checks the status of your mask. But we just trust each other and we hope that everybody does the best. So even if some amount of people put this app on, we can dramatically decrease the need of unnecessary quarantine or need of just blindly testing anybody, whoever we can encounter. And of course, the last thing I want to talk about is PPE. So PPE right now poses a separate hazard. There's a few specific hazards to PPE, such as muffling sounds when you talk that make a working process harder, or overheating, heat stress because you have to put a PVC gown on, and things like that. At the same time, there's hazards like people don't oftentimes think. For example, if you reuse disposable PPE, it actually can accumulate some particles on it, and when you try to doff it, when you take it off in the end of the day, or even if you go from one patient to another, it can become a media that actually helps to cross-contaminate, or you can get infected as you try to take it off, because when you do that, you actually toss in the air all of those particles that have been accumulated throughout the day on your mask or other piece of PPE or in your gown. So the ultimate solution is to sanitize it before you take it off. But of course, most of the PPE is not suitable for that, or it's extremely not uncomfortable, or it might be expensive, or things like, for example, poppers. The hoods for them, they're oftentimes made of materials that are not well sanitizable, and people just don't pay attention to it. They don't think that they have the hose behind their back that is actually a huge surface that can accumulate particles and then disseminate them as you walk out the room. So you walk out, you think you're safe, and then you take it off and you get infected, or you infect other people. So to bypass this, we need a suit that is fully enclosed and can be easily wiped down. And this is my prototype of the suit I made actually for less than $150 from the materials I had. You could easily buy it, not affected by the. It was one of my specific requirements when I was doing that. It should not be affected by the things such as shortages of PPE and things like that. So with all that, I managed to make it on my own at home, and this is just to show how simple and easy it is. But this suit allows to it can be wiped in a few seconds, so you can wipe it in between the patients. You didn't have to take it off to sanitize it. At the same time, it gives you extreme high comfort because of this big filter that it's in back, and it has pumps inside. So you can see there's a filter, and it has inside, it has two pumps, one of which blows the air under the suit, and it then gets eliminated through the valves. You cannot see them here on your arms and legs. So the heat is being taken from the core of your body and moved outside, so you stay extremely comfortable inside, so you don't tend to stick your nose out of your mask because it's comfortable and you want to wear it properly. And the same thing goes for the system that's inside. So it has the battery that allows it to run for more than 12 hours on a single charge, and it's a cheap, lightweight material. At the same time, it's durable. I used a motorcycle rain suit for that purposes. It has a fully ventilated mask, and it has an additional set of filters for the mask. You can change them frequently, or they're just super effective because you can use patient circuit filters that are extremely effective. And so you get extremely clean air inside the mask. And so this is comfortable, this is durable, reusable. So it in the end of the day, it reduces your expenses, even though it might cost slightly higher than disposable single piece of PPE. But at the end of the day, throughout the pandemic, throughout having those issues, you will end up having a great savings. So these are the things that I just wanted to point out. I hope you find something interesting in this video, and I hope for your understanding and response, because as I said, I'm looking for any support. I'm looking to push this idea further. Unfortunately, I have been faced with extreme ignorance. Many hospitals and facilities that I've tried to contact didn't even reply with things like no thank you, and I think this is just immoral for healthcare providers in this time to ignore having some of these options available, but just not using them. You can save so many lives, you can save so much money by just implementing those simple things. And the best thing about it, it actually helps us to regain the control and make our environment safe in the face of growing infectious hazards and our growing of our society susceptibility to infectious disease and ability to spread those diseases. And please share this video, please comment on it, and please say what you think, and please contact me. So you probably have my contacts in the letters, and I'm gonna also put them in the bottom of this video. And have a great day, everybody.